Hospital food just got weird. Your doctor tells you that you need to stay in the hospital for 2 weeks. You're nervous. But then they say something worse. The cafeteria is going plant-based. No chicken, no fish, no dairy, just vegetables and beans and whatever else they're putting on your tray. And here's the thing that should bother you. Hospitals are terrible at making that food taste good. So how do you recover when you're eating something you actually hate? Turns out, someone finally asked that question seriously. Hospitals have a real problem. They need to feed patients nutritious food while keeping costs down and hitting climate targets. Sustainability sounds nice in a mission statement, but in reality, it crashes hard against something very human. Nobody wants to eat rubber vegetables when they're already feeling terrible. The old assumption was simple. You could either have meals that were sustainable and cheap, or meals that patients would actually finish. You couldn't have both. The food industry and hospital administrators just accepted this as fact. But in late 2025, a team of researchers in Amsterdam decided to call that bluff. They wanted to know if you could actually design plant-based hospital meals that checked every single box. Nutrition, taste, cost, feasibility. All of it. That team was led by MA van Bree and HM Kruizenga at Amsterdam University Medical Center, working alongside communication scientists and industry partners. They published their findings in the European Journal of Nutrition in June of 2026. This wasn't some quick survey study. This was a full collaborative design project that ran from April through December of 2025, pulling together hospital chefs, nutritionists, patients, procurement people, and food manufacturers to actually build something new from scratch. Here's how they did it. The team ran what's called a co-creative workshop. Imagine a design sprint, but for hospital food. Over the 8-month period, they brought together stakeholders from the hospital side and industry side multiple times. The goal was straightforward: develop actual plant-based meal concepts that hit specific nutritional targets, tasted good to real patients, and could actually be made in a hospital kitchen without breaking the budget. They weren't just theorizing. They were building prototypes, testing them, iterating, getting feedback from actual hospital staff and patients, then going back to the drawing board. It's the same methodology tech companies use when designing apps, except applied to something that genuinely matters, keeping hospitalized people alive and nourished. The findings are where this gets interesting. First, they successfully created multiple plant-based meal blueprints that delivered complete amino acid profiles. That was the original roadblock. Plant-based meals often lack one or more essential amino acids, meaning your body can't fully use the protein. These new meals solved that problem. They combined legumes, whole grains, and supplemented ingredients in specific proportions to create nutritionally complete plates. That's not trivial. That means a patient could actually recover properly on these meals, not just survive on them. Second, when they tested the meals with real patients and staff, the palatability scores were higher than expected. We're talking about hospital food actually being edible. Not delicious, but genuinely acceptable. People finished their plates. They didn't push food around and leave half of it uneaten. The team identified which flavor profiles and textures worked best. Which preparation methods made plant proteins taste less like textured sadness. Which combinations felt like actual meals instead of penance. Third, the cost analysis showed something remarkable. These meals were not more expensive than conventional hospital meals. In some cases, they were cheaper. That demolishes the old assumption that sustainability requires a price premium. When you're buying ingredients in bulk and designing menus around seasonal produce, the math actually works. The hospital doesn't have to choose between feeding people well and keeping the budget stable. Fourth, and this is crucial, the team identified exactly how these meals could be implemented in real hospital kitchens with existing equipment and staff. This wasn't theoretical. They found the specific operational changes, training needs, and supply chain adjustments required to make it work. That's the difference between a brilliant idea and something that hospitals can actually adopt tomorrow. What this means in everyday terms: if these blueprints get adopted widely, hospital patients won't have to choose between recovery and sustainability. The person lying in a hospital bed, already stressed about their health, can eat something that tastes decent, meets their nutritional needs, and doesn't contribute to climate collapse. That sounds simple, but it's genuinely radical. There are some honest limitations here. This was one study at one institution. The co-creative process was collaborative, which is great for buy-in, but it also means the meal concepts were partly determined by which stakeholders showed up. Different hospitals in different countries might face different challenges, and the study tested palatability with relatively small groups. Scaling up to feed thousands of patients every day introduces new variables. The kitchen staff reaction in month 1 might differ from month 8 when they're tired. But here's what it does prove: the core assumption was wrong. You don't have to sacrifice patient satisfaction for sustainability. You don't have to pick one value and abandon another. With proper design and stakeholder input, you can build systems that work for everyone. This sits at the intersection of 3 huge trends in modern healthcare. First, hospitals are desperately trying to reduce their carbon footprint. Food waste and livestock agriculture represent massive portions of hospital environmental impact. Second, there's growing recognition that hospital nutrition directly affects patient outcomes. What you eat shapes how fast you heal. Third, there's this broader movement toward co-design and stakeholder collaboration in healthcare. The old expert knows best model is dying. Modern healthcare design requires listening to patients, staff, and suppliers. This study suggests that all 3 of these trends can actually reinforce each other instead of competing. Better nutrition outcomes, lower environmental impact, and staff buy-in don't require trade-offs. They require design thinking. The single most striking thing here is this: we've been running hospitals for over 100 years. And somehow, nobody seriously tackled the question of whether plant-based hospital meals could actually work until 2025. That's not because it was impossible, it's because nobody bothered to ask. Now that someone has, the answer looks pretty clear. So here's the question that should be keeping you up at night. If this works in Amsterdam, why isn't it already in every hospital on Earth? Turns out scientists have been busy, and they're not done yet.